Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is the January 2016 CEO Connection. Today, I have a guest, Dr. Jyoti Chaudhary, with me. She's a general internal medicine physician who just joined our staff this last September, I think it was,
Yes.
wasn't it?
Mm-hmm.
And she came and has assumed responsibility for the practice previously that Dr. Walton had. And as we've talked about earlier, that Dr. Walton is now one of our hospitalists, and so we're really pleased to have him continue in practice here in Batesville. Dr. Chaudhary, tell us a little bit about your education and what did you do before you came to Batesville?
Okay. So basically, I did my med school back in India, and then I came here in 2009 and did my internal medicine residency at Hopkins program at Sinai Hospital of Baltimore. After I finished my internal medicine residency, I worked as an assistant professor of medicine at University of Virginia, and then I moved here.
Yeah.
And I'm doing internal medicine practice here.
Is there anything in specialty or anything that you really want to emphasize in your practice, or are you doing general internal medicine?
So it is basically general internal medicine, and we deal with all type of chronic medical problems like diabetes, hypertension, COPD, asthma, CHF. I mean, any medical problem basically. And then we also see all the healthy adult patients who are just here and there for screening and basically just for preventative medicine. So we talk about immunization, age-appropriate screening for cancers, all of that stuff.
Mm-hmm.
And I'm seeing a lot of patients with diabetes, complicated diabetes.
In fact, you're going to speak in January
Yes.
at our community education event, aren't you?
Right.
Yeah.
And
you can talk about.
I hope it will be really helpful for patients who really want to know more about diabetes, about the treatment options, and how they can take better care of themselves.
Mm-hmm. Mm-hmm. I know the community health education event is usually very well attended, and
Mm-hmm.
I bet you have a lot of interest in that.
Yeah.
You know, your education is really exceptional. I mean, God, those schools you went to are really great.
Thank
and
you.
So it's a real tribute for us to have you in Batesville and practice in here.
Thank you.
Being a general internal medicine, how do patients get to come and see you?
So yeah, basically we're taking new patients as of now, and they can just call our clinic, and we will be able to get them pretty soon in our schedule, and we will start seeing Medicaid patients as well pretty soon. So until now we were not really able to, because that process was still going on. So now we'll be accepting Medicaid patients soon.
You're right now taking Medicare though.
We are taking Medicare for now, and all other insurances as well.
You know, that's one of the problems with a physician that comes into Arkansas right now. It takes so long to get the
That's
Medicaid
true.
numbers
That's
so that
true.
they can
But I'm
start seeing
excited
patients.
now we'll be able to see the Medicaid patients as well.
Yeah,
Yes.
I know it takes quite a long time to get that done, so I know
Yes.
that it would be great to have those
Right.
numbers so that you can take care of them.
Yes.
And you're married, Dr. Singh
Yes.
is a rheumatologist. He practices with you in the
Right.
same
in
building.
The same office, yes.
Well, it's actually the same building as where Dr. Walton practices.
Right, exactly. Yes.
And you got a little boy,
Yes.
How
We have
old
a
is he?
4-year-old.
4-year-old.
Yes.
Yeah.
Yeah.
I think when we were doing the interview process, he accompanied you sometimes.
Yes,
And he was
he
always
did.
so much fun to
Yeah. He really loves meeting people. He enjoys
see. Yeah.
meeting people, having fun.
I bet you're enjoying him as well.
Yes. Yes.
Well, I really appreciate you coming in today
Thank
and giving me the opportunity to introduce you
Thank you so
as a
much.
CEO Connection. And so
Thank you.
I know that people are listening to this, so want to come to the community health education event.
Mhm.
What's the date of that? Is that
It's January the 12th.
January the 12th at
Yeah.
noon at
Yes.
Josephine Ray Rogers Center.
Right, exactly.
Great. Well, we'll look forward to seeing you then. So
Thank
thanks
you.
for coming
Thank
today.
you. And I want to wish you all a very happy and healthy new year. Thank you.
Okay. The standard for January is demeanor, and demeanor it takes on the connotation of how we present ourselves physically, but it also takes on how we present ourselves in terms of how we act and behave. And so whether we're involved in what's going on at the hospital or just how we present ourselves. So during this month of January, let's really focus on demeanor and put our very best face forward. In January, we have two employees of the month. First, at White River Medical Center, we got Curtis Minette. You know, Curtis, I've known for many years. He's been here almost 15, and over those years, I've seen Curtis in the radiology department. He's a nuclear medicine tech, and I've seen him interact with patients. I've seen him interact with staff. I've had a lot of interaction with him personally, and gosh, I just can't think of a better employee of the month than Curtis Minette. So I hope that when you see Curtis, you'll recognize him and congratulate him on this honor. At Stone County Medical Center, we have Pat Bracken, who's an RN, and Pat is the manager or the director of their surgery department over there. She's been with Stone County Medical Center for 24 years, and Pat, I know over that period of time, has really done a great job at Stone County Medical Center, and so it's great that she's been recognized as well. So just like Curtis, when you see Pat, be sure to recognize her and congratulate her on the honor of being Employee of the Month. We have some new providers joining our medical community in January. And at Calico Rock, I'm really pleased to announce that Doctors Knight, Lane, and Wright have become employees of White River Medical Center. And they all practice at Calico Rock, and we're really proud to have them be a part of our team. In addition to Doctors Knight, Wright, and Lane, Christy Branscombe is an APRN who will be joining us out of that Calico Rock clinic as well. So please welcome them aboard. At our Tuckerman Medical Clinic, Ashley Bagwell, an APRN, is joining us there, and so we really look forward to having Ashley come aboard and the contributions that she can make to improving health care in the Tuckerman area. So when and if you see those 5 providers, please make sure that they feel welcome. Each year at this time, the White River Health System Nominating Committee meets and makes recommendations for new officers for the upcoming year, as well as new board members. In 2016, Boris Dover will become president of the White River Health System Board. Steve Case will be our vice president. Les Frensley will be our secretary, and Charlie Schaff will be our treasurer. Charlie has been the president for the last 5 years, and so he will now assume that responsibility as treasurer. Charlie is a CPA, and previously actually worked at a hospital in Jonesboro before coming to Batesville. Boris Dover's been on the board for several years, and Boris is the president of First Community Bank, and I know Boris will really do a great job in that leadership role. So when you see any of those officers, be sure that you thank them for the services that they provide for all of us. In terms of new board members on the White River Health System, we have Phil Baldwin. Phil is the president of Citizens Bank. And we also have Doctors Glasgow and McLean will be on the board as well. So those 3 new members of the White River Health System will be coming on in January, and I know that they'll really do a great job spending a lot of time in making this health system a better place. The White River Medical Center has an advisory board, and each year their new members are appointed to that. And so the new members to the advisory board is Dr. Andrew Fisher, Jonathan Friart, Kyle Gaither, Barry Hammer, and Chintan Patel. All of them are from this area, and I think they'll be really great representatives of the community and give us good advice on how we can better represent the community and better provide care to it. So please, if you see any of those folks, you'll want to thank them for their service on the White River Medical Center Advisory Board. Beginning in December, we started our renovation of the emergency department of White River Medical Center. As most of you know, we've been talking about this renovation for several years, and we've just started the process. I've met with the architects and general contractors this last week, and it appears that we will complete the project sometime in September or October of 2016. So we're talking about a 9 to 10 month project. During that period of time, as you might expect, there'll be several phases. There'll be some disruption and noise and all those things that go along with renovation. So please bear with us as we go through this. we're going to do our very best to provide the best care that we can down in the emergency department, recognizing there will be some limitations during that construction period. So at the end of the day, next October or so, we'll have a brand new emergency room, which will be better able to serve our community. You know, emergency department is really important to the hospital and how the public and the community perceives us. And so it's well overdue that we renovate our emergency room, and I'm really looking forward to the improvements that will occur. January 31st, 2016 marks our 40th anniversary of White River Medical Center. You know, this is a milestone that we'll celebrate this next year, and I know our marketing department will be putting together some great events that commemorate this milestone. This concludes the January CEO Connection. Hope your holidays have been joyous and blessed, and look forward to the advances that we can all together achieve in 2016.